Ooh, you gotta keep walking. Okay. Ooh. Hey guys, welcome back to my channel. So guys, I started my new job at the Alcohol and Detox Center. So like I was telling you guys in my previous video, I am a detox / admit nurse, but I'm mostly doing admits, but we cross train, so I do see a lot of everything here. So my job here is when we get a patient in, first they go to the front desk, check in, then they see a counselor, then I get them in order to see if they're a-okay for admit. So we go through a series of questions. That way I could find out what scale they're using, whether they're on the CIWA or the CIWA, and I will go into more detail like that. Now, if they have an addiction to like heroin, for the heroin we use the CIWA scale. For alcohol, there's the CIWA that we use, and then we also use the CIWA for the benzo addiction. So the only time patients aren't sent to have detox and they're sent to the residential side, which I still do admit those as well, is if they have addiction to cocaine or marijuana, things of that nature, because you can't actually detox from those. So for our patients that have the addictions to opioids or benzos or alcohol, they all get Cirex. So Cirex is already ordered, and yes, it is a benzo, but it isn't a highly addictive benzo, so that's why that is the drug choice to help detox these patients, because the Cirex is tapered down gradually for 5 days, because when they are admitted to detox, they are in detox up to 5 days. So unless they go AMA or they have to be sent out to the ER due to side effects from the drug use that they were having, like high heart rate, chest pain, seizures, that sort of thing, that's the only time we'll send these patients out. So our patients with the opioid addiction, if we using the CIWA scale, and if the CIWA scale is at least an 8, so our patients that have opioid addictions, when I do admit them, there's a process of going about it, and I will go into more details like that. But when I am ordering the medications from my admit orders, once talking to the doctor and verbalizing it, because we use cell phones supplied by our facility to contact the doctor in order to get these orders going. And especially if these patients are coming in with home meds, we have to get orders to say it's okay for those patients to continue home meds. So the patient is admitted for the CIWAs, for opioids, and we're using the CIWA scale. So our patients with the opioid addiction, if we're using the CIWA scale, and if the CIWA scale is at least an 8, they get a one-time dose of tramadol, and then the following day we're doing the tramadol protocol. So they get tramadol every day for 5 days, but each day it's tapered down. And then for our patients that come in with the alcohol addiction, we do the thiamine protocol. So they get the one-time dose of thiamine, and then every morning they continue to get the thiamine for 5 days. Hey guys, so I finished my last day of orientation and training as an admissions and detox nurse. The cool thing about it, next week I will be cross-training in detox. So I'm pretty excited about that. Mind y'all, don't mind me, I'm driving and trying to like film y'all some stuff real quick. So today we had 2 admits, both were admitted. Well, one was admitted for heroin use, so we did do the CIWA scale. And then the other patient was admitted for marijuana, which you can't detox for marijuana. So we do have a 28-day program that those particular patients go to. They get vitamins and things like that, but they don't get any detox meds. I know you guys all probably have that wondering question: what type of patients do y'all take at your facility? So the patients that we do take at our alcohol detox center, they cannot have dual diagnosis. So at the time, so if they are have any psych history, they have to be stable, have to have been on their meds and stuff. Other than that, we don't take any psych patients. We're just a substance abuse center. But like I said, we do take patients that possibly have a history of psych but are stable on their medication. So now I'm going to get into showing you guys my little cheat sheet, the information that I normally get from the patients. So this is it right here. Sorry guys, I'm sitting in my car. Just drove from work, so I'm just trying to get this information to y'all. So this is my cheat sheet. So we get our patient's name, date of birth. Then we ask our patients, why are you here? Some of them will state, I'm here because of heroin, I'm here because I do drugs, and things like that. So then we ask them, when were you last treated? Some might say 3 months ago, some might say a year ago, 6 months. We ask them inpatient or outpatient treatment, where did they get the treatment from, and how long did they stay sober before they relapse. Then we also ask them, what are their plans after treatment. Most of them normally state sober living. So of course this comes to our psych information. We ask them if they have any suicidal ideations, homicidal ideations, because if they are, we cannot take them in. They have to go to a psych facility, because we only deal with substance abuse and not dual diagnoses. So we ask about their psych history, whether they have depression, bipolar, schizophrenia. We also ask them, when were they treated for, inpatient, outpatient, are they compliant with their medications. We get their medication list from them, whether it's non-psych medications and medication for hypertension, diabetes, that sort of thing. We also see how many meals they eat, the percentage of the meal that they eat. Sometimes we get most that say they eat 1 meal a day. Some of them say 3 meals a day and they eat all of it. We also get their intake on water, how much they consume a day, have they lost any weight recently, were they trying to lose that weight, how many pounds did they lose. All these questions do dedicate to their care plan, how to get treated, if they need help with nutritional aspects in their diet, those sort of things. We also have to make sure to see if they have a latex allergy. Can they read and write? Because we do have some that have trouble reading and writing, and we do have a schedule for them throughout the day that they have certain activities that we do encourage them to participate in. We get the medical history, their medications. Then we get drug use. So here we ask them what drugs they're using, and if they're using any other drugs. We ask them how long they've been using it, the amount they use, how do they use it, whether it's IV, whether they snort it, that sort of thing, and when was the last time they used it, because that also plays a factor in their withdrawal symptoms. And then we also get information if they have any drug allergies, to basically allergies to medications that we may supply. Are they allergic to any foods? Of course, because they have a regular diet at this center, so we need to know what they're allergic to. We also ask them if they have any dental problems. That predicates to their nutritional status as well, because if you have dental problems, that can affect your eating. We also evaluate if they have any hearing or vision problems, whether they're impaired, do they wear hearing aids, do they wear glasses, that sort of thing. And then we also ask them, do they have any STD, infections, diseases, open wounds, and tattoos. We need to know that at the facility. What's going on with them. Do they have Hep C, HIV, any of those things? Any open wounds on their arms, scars due to using the scars, which can be due to them using drugs. Because a lot of our heroin patients, their arms predominantly their hands are a lot larger because of the IV use of the heroin drug. They might have little scabs all over, open wounds, drainage, and that's a safety infection type of thing. We also see if they're up to date on their childhood shots. Do they smoke? How many packs a day do they smoke? Because we do try to encourage them to decrease smoking, smoking cessation, but we also allow them to have that because they are going through withdrawal and they do need something to help them get through that. So we do allow them to smoke cigarettes, but they can't have phones on the premises, candy, that sort of thing. We do supply them with snacks. And last but not least, we see if they have a primary care provider, and if they don't, we do refer one upon discharge. And we also see what surgeries they have had in the past or recently. So we do that. So it's pretty cool. We get a lot of background information on these patients. And just to get down to the bottom of things, they do go see a counselor as well. So we just try to dig deep as much as we can so we can help these patients out because they do need help. Sometimes traumatic things causes people to become, substance or drug abuse users. So we're here to help them heal or get to that point where they can manage on their own. Guys, I'm just getting home, walking home. I'm going to go over the cows and the CIWA scales real quick with you guys. Then I'm going to get in the tub, take a hot bath, relax, catch up on reading some questions because I have a calculations exam next Tuesday when I go to class. Have to make 100% on it. It's only 10 questions in order to continue to be in the program before we start clinicals. So wish me luck with that. Guys, here it goes. So this is the CIWA scale that I was telling you guys about. So it's the clinical opiate withdrawal scale. So for our patients that are getting admitted on detox, everybody gets Cirax, and that's already in our admit orders. And if their CIWA is an 8, they get a one-time dose of tramadol, 50 milligrams, and then the following day starts their tramadol protocol, which is the tapered dose. Okay, so the CIWA scale, medications that are considered involved with this is heroin, morphine, codeine, hydromorphone, oxycodone, and fentanyl, okay, and so much more. So the questions that we go through are these. So we see what their resting heart rate is. That's a factor. We also see if they're sweating within 30 minutes. We also see if they've been sweating for the past half an hour. We also check if they had any restlessness or difficulty sitting still, a lot of movement. We check their pupil size. We also ask them if they're aching or they having body aches. We also see if they're having runny nose, tearing, allergies, that sort of thing. We also see if they have any type of GI upset, whether it's stomach cramps, nausea, diarrhea, vomiting, whether they're having tremors or reporting tremors if it's not observed. We see how many times, if they yawn during assessment, if they yawn at all. And then we also evaluate, or if they're anxious, we ask them that type of thing, and if they having goosebumps, which is goose flesh skin. So like I said, we use this protocol. This determines whether they have to give. The scale determines whether they have to give now dose of tramadol, 50 milligrams, but everybody starts the tramadol protocol the following day, even if their CIWA is not on the scale of 8 and above the day they're admitted. Know who they are, where they are, and what day it is. This brings us to our CIWA scale. So this is for the alcohol withdrawal assessment. So everybody gets Cirax as well because it's detox. But if they also are having alcohol withdrawals, they get thiamine. They get a one-time dose, and then starting the next day, they get thiamine every morning for 5 days. So we ask questions about nausea and vomiting. Are they having tremors, sweating? Do they have any type of anxiety? Are they agitated? We also ask them, are they having tactile disturbances like feeling things that aren't there, like pinching, crawling under the skin. We ask if they can hear things, any auditory disturbances. We also ask, are they having any visual disturbances, seeing things that aren't there, any headaches. We ask how high, how low it is. And then we also do our orientation. Do they know who they are? Last but not least, this is our scale for the CIWA for benzo. And everybody gets CREX, like I said. So this qualifies for Xanax, Librium, Valium, Ativan, that sort of thing, okay? So we have to do observations on them as well. So restlessness and agitation, tremors, sweating, agitation, fatigue, feeling tense, difficulty concentrating. Do they have a loss of appetite, numbness, palpitations, headaches, stiffness, achy joints, any anxiety, GI symptoms, how they've been sleeping, do they feel weak, that sort of thing. Any visual disturbances, do they feel fearful, and have they been worried about anything else? A thorough assessment to see, the status of our patients. And that's how our scales go, guys. So I hope y'all are enjoying this video, and I hope I'm getting out this information to y'all in a great way. So next week I will be cross-training in the Detox nurses station, just getting my hands on of how to taper the dose, how to administer the medications to these patients, seeing the withdrawals that they're going through, and also seeing how day by day they are actually doing a little better, coming down from that high that they possibly are having. So I hope you guys enjoyed this video. I hope it was very detailed for you guys, and I hope to see y'all soon. Thanks for stopping by.